Do you often forget or get confused about your medications? Will you be able to get help if you fall taking a shower and cannot move? WatchRx provides a dedicated smartwatch which gives medication reminders that display an image of the medication along with the dosage. It also has a dedicated SIM to make or receive phone calls without having to pair with a smartphone. A GPS chip in smartwatch also notifies your caregiver if you wander out of your home. Your caregiver can live track the person and call the smartwatch directly. And most importantly, it is a watch, and hence no stigma of wearing a medical device. For more details, please visit www.watchrx.io.
Hi, I'm Jayanthi Narasimhan, founder and CEO of WatchRx. WatchRx provides a smartwatch for seniors to help them stay in their place independently with dignity. We also provide a caregiver app for caregivers, family caregivers, to get their peace of mind and stay connected with the seniors. The watch provides visual medication reminders, so it is easy for seniors to take their medications without fail. And we have a remote patient monitoring platform that connects the physicians, the caregivers, the professional and family caregivers, and the patient. So the patients can be monitored at home and for all their chronic illness and improve their condition so that we can prevent hospital admissions.
Hello, my friend. How are you doing?
Thank you. Thank you. It's so good. It's been really good. In the past year has been very good for WatchRx.
Oh my goodness. Sorry. So we're gonna before we start talking about WatchRx. So we met. We met years ago.
Right.
And I was doing office hours, and you wanted to get some marketing concepts and thoughts, and I loved it. I love the product because I took care of my grandmother for 21 years, and your product was just something that I could understand clearly. But before we talk about the product, who are you? So tell me about where you come from, where you are, what led to this point?
Okay. Yeah, I come from India almost 30 years ago, and I've been working in telecom fields for the past 25 years or so. So developed many innovative products that had been deployed world over, AT&Ts and Verizon. So a lot of telecom expertise. So I had been in executive management positions in many companies, taking care of the software and hardware development for the telecom products. So 5 years ago, my mom was sick, and then things changed. So her medication complex became her medication regimen became so complex that she was always forgetting her medications, and she was going to hospital so often. So we used to call her. She lives in India, and I used to call her every day. Okay, did you take your medications today? Or call her before the medication time is due, which was putting a lot of stress on me. And because I have been in meetings, I work full time and family and everything. So it was very hard. And I wanted to find a simple solution for her. There were a lot of apps. So no doubt that there were medication apps and everything. But for her, over 80, it was just impossible for her to use a smartphone app to keep track of her medications. That's how I thought about WatchRx, and a simple watch that just gives her medication when it is due, and it was great. It worked excellent for her. And I also developed an app for myself so we stay connected. Regardless of whether I call her or not, I would know when she took the medication. That's how I started the company, and that was my initial thing.
So I'm going to rewind back a little bit more before the situation with your mom. What was the degree that you had? That you were focused on telecommunication, but what were your roles in it? And how were you the person that was capable of creating this technology?
Yeah, I have by training I have an engineering degree, so electrical engineering. So I knew both hardware and software, and I was working completely on telecommunication from the start. I graduated from Indian Institute of Technology, Chennai, and I have been working on telecom products. Once I came to this country, that is the time when Sonnet, SDH, IP, everything was taking off. So I had already implemented when I was in India some protocols, so that gave me a lot of experience here coming here. So I started working with Fujitsu. So we had developed a lot of products, and Fujitsu was almost number one, close to 90% of the market at that time. So we started to develop many products, and then we switched over to voice over IP technology, developing many communication products, and then the device management. So we had a lot of devices on the network we had to manage. So for AT&Ts and Verizon's, we started developing management products, and then that's how I came to know how the connected technologies work, like IoT. So you have devices, you put the devices onto the network and you monitor the devices, how the communications work, and how you need to do both hardware and software. The greatest advantage for me was I was trained in both hardware and software. So it gave me a lot of input. Also, I worked on cable technologies. So basically, all the set-top boxes, how do you connect to TV, how they communicate, all those things. So that was the background, which is a completely a technology background that helped me to think of a solution in the first place. So I started looking at wearables. So I said, okay, we can come up with the wearables. But then my mom loved the watch. That's where the watch came from.
So it's so interesting. So I think that's one of the conversations we had when we first met was how my grandmother had the what's that the one that you press
Life alert, yeah.
like exactly lifeline.
I can't get that. Yeah.
Yeah. So yeah, exactly. So she had it, and the amount of times that I'd walk into her house and it would be on the table, it would be in the bathroom, it would be by the tub. She never wanted to wear it. Why did you get? I mean, again, we're gonna go into like what the product does a little bit deeper, but how did you convince your mom to wear the watch versus the fact that, again, my grandmother, when I left, she had it on, and then I'd come back to check on her, and it was everywhere but on her. So what was that essence of why your mom wanted to wear it?
My mom always loved the watches. It's like something fashion for her. I have actually, as the fashion changes, I used to keep buying her new watches. So this is one of the things that she would love to wear it. My dad also, he just loves to wear the watches. So for both of them, watch being a thing that they really like. And they come here, and every time they come, they used to come here every 2 years. I used to go and get a watch for them. So that is something that it is like, I know that they love it, and they want to wear it. So that is why when I came up with the watch idea, my mom like really loved it. Wow, that's good. That's great. And my dad wore it, and I said, wow, it looks so nice.
And what
They
about?
both love it. So
All
I
right.
did.
So now, what about other consumers? Is it possible to have it in a different? If they don't want to have the watch, is it possible to wear it in any other way?
Pendant is another form factor, but the main resistance why people were not wearing life alert was that they would only want to wear a jewelry but not a medical device. So that is the problem. So we had to package it in a jewelry format. Of course, it is possible to do that nowadays that you get the GPS pendant and all that in a jewelry format. So it is possible. But the thing is that wearing a watch, there is sensor, so you can measure things. Like my watch can measure the heart rate, it can measure the activity, motor movements, and things like that. So the watch is much more convenient for that than wearing a pendant. So depend. If you wear a pendant, it will be very restricted features. So that's why. And also it has a camera. So when there is a camera, it's much more functional to use it on the wrist, whereas on the neck. So you can't really do much over there. So there are a lot of other uses to being a wearable as opposed to a pendant.
All right. So then let's talk about the essence of what the watch does. So so walk me through every single step of, because at the beginning you said it, but you said it so quickly. So walk me through what does the watch do for the individual that's wearing it, and why did you decide that it had to be part of this?
The watch, basically the features of the watch is it has a touch screen display. It has a phone, SIM card of its own. You don't need a smartphone. And it has GPS tracking. It has multi-axis sensors to measure your activities and movements. And it's also completely digital, so it makes it easy, and it is waterproof. So this the watch is waterproof. You can wear it in shower, you can wear it in rain or the kitchen, those things you can do. So those are all the watch features. And as far as the functionality is concerned, we started off with medication reminders. So the biggest confusion people have is Do I take a red pill or a white pill? How does it look and all that?
Mhm.
So that is why we decided that we would put a picture on the wall, picture on the tablet as filled by the pharmacist, not a brand name or anything like that. It's exactly what is in your pill box. Then we came up with the voice instructions because a lot of times the medication has to be either taken with water, taken with food, or before or after. And there
Yeah.
are so much complications. So it's not always like time bound. You take your pill at 10 o'clock. It's not like that. There are some medicines like that, but most of the medicines are around time. So we decided that we will come with specific voice instructions on how to take it, and we will show the picture. And we will also have vibration on the watch. So in case if you are sleeping or something, the watch would vibrate. So that is how we decided to do. So once we did the medication reminders, then we went on to other features. Since it has a built-in SIM card, then you can do a phone feature. Then you can do text messaging. I can send a text message and get a response without them typing a whole lot. So I could do prompt and then they can press yes or no kind of a thing. So we can do text responses. We can also schedule text messages and responses. And then the caregivers can send a text message to the watch. So we will actually display the text message and they have to acknowledge it. It's not like a phone where the message comes and goes away and you don't know how to get back to it. So this is actually a display and we wait until they touch and acknowledge, okay, I read the message. So those are some of the features. So you can do reminders for your food, water, exercise, anything personalized that you can do. So it's a biggest part of the whole thing is a personalized way of communicating to the patient, not just a generic text message.
I love that you have really got into the mind of an individual that is wearing this, where sometimes they're so busy and they swipe it and you're right, they lose the message. Also, it doesn't turn off until you touch it. There's so many times that I would fill my grandmother's pill box, and I would literally fill it on Sundays the entire week, and then on Fridays I would come, or Saturdays I would come to refill the next week, and there's days that were never touched, which just like, which I mean, I every day I'm shocked that she lived to 95 years old, because the amount of time that she didn't take her medicine or her insulin because she was diabetic was shocking to me. So I love that you were able to communicate that through the app. What has the pandemic done to your company, and the way that you're producing out the company, the product, but also a lot of elderly are home and family members can't get to them. So how has that elevated what you do?
Actually, ironically, yes, COVID-19 I have got a lot of traction during this time. Once the COVID-19 started hitting, so I have very good amount of traction. And also, I have earlier this year, I released a remote patient monitoring platform along with that. So basically, that means physicians or professional case managers can actually remotely monitor seniors at home. So you don't have to really have them come into your office. So another thing that I have started is integrating other vital devices like a temperature, blood pressure, blood glucose into our platform. So you can pretty much, based on the disease, you can monitor their conditions, their medications, their movements, everything that we can monitor. So that is a big thing, and especially with COVID-19, that has become a big push for us. So now I get a lot of traction. People who want to offer the remote patient monitoring, the physician groups and telehealth companies, that they are reaching out to me. So it's basically a good thing for me that it started. And also, late last year, CMS had already come up with increased the number of codes for remote patient monitoring. That started the whole process. So now there is a way for us to provide the solution to seniors without them having to pay for the monthly subscription. So that's a big boost for the seniors and the caregivers, that now they can actually use the product and they don't have to pay money for on a monthly basis. And the physicians get to benefit by it because we automated a lot of workflows. How the monitoring is done, what kind of data collected, what kind of analysis that we can do, and interpret and provide them answers. So that way, the physicians can spend much less time, and at the same time, they have the revenue opportunity. So it's been good.
So I was going to say that, I mean, I met you at the beginning stages. So how, I mean, this product, is it better for the consumer, as in like literally where I can go and purchase it for my family members? or is it better for the hospitals and the doctors or the private practice doctors to provide it to their customers? Which one is more beneficial, or are they both?
They are both, but I did try initially B2C, direct to consumers. There is one, a lot of them, they're interested. Product has been getting reviews like everybody loves the product. The problem that they have been having, couple of people, they would come and every month they would come and visit my website, but not buy it. So I was able to track them. So when I asked them, so the thing is, okay, I'm supposed to get Medicare, Medicaid, and why can't the government covers it? Because it's going to be beneficial for them too. Or why can't the insurance companies covers it? Because it's going to reduce the hospital admission. So why do we have to pay? And which I understand perfectly, because on the one hand you are paying premiums and you are eligible for things, but on the other hand, things like this, which is totally related to health, that they are not able to utilize. So that was the thing that was there in the consumer side. So what I did was I pivoted from B2C, I moved into B2B. So then I started to work with telehealth companies. That's when the traction of really getting into, okay, let me try your product, let me get into business agreement started. Until then, it was a very tough road. And even though consumers ask questions, in the end, they're not able to buy it because of that. So now I think once we changed to B2B, it was much better and we were able to work with the B2B customers. Then the CMS came and introduced a lot of new things, and now it's even better. So that post-COVID, government has really pushing the telemedicine and telehealth, which is a great boom for us.
It's funny because I've had 3 doctor's appointments via this, and it's comfortable for me because I'm used to the Zoom or things like that. Because I mean, this is how I run a lot of things that I do. Whether because I'm traveling so much overseas that this is how I can actually communicate to people at home. But it's very interesting how the doctors are having a tough time because they want to see you, they want to touch you, they want to make sure that they're double checking. And so the younger doctors love this. The older doctors that are the more knowledgeable ones are not comfortable with this. This is the same thing that we're finding in the universities and colleges. You go to the university and college for this professor that's been around for quite some time that has a lot of knowledge, but yet they don't know how to use the technology, and so they're not doing as well as the younger professors.
That is true. I recently, as recently as 2 weeks ago, there was a physician who actually wanted to use my product for himself. So basically, he said he loved the product, and he said, "Oh, I want to use it." And I said, "Fine," and I set it up everything. But had a tough time for him, even though he doesn't have to do anything. Sometimes the charging and even to get this, though it is a magnetic charger, for some reason he was like kind of afraid of technology. Oh, do I have to do anything? I said, "You don't have to do anything. Put it in the charge, take it out, and wear it. And so that's all you have to do." He says, "No, no, no, don't I have to do the settings? I have to go back and change settings." I said, "No, you are done. Once setting is done, it is done. You don't have to keep going back and doing it again." So they are like a little bit afraid of technology, especially the physicians themselves are really not sure how to use it, how to use the platform. So the younger generations, yes, they have absolutely no issue. They will go in and change everything and they can make use of it, but the older generations is a little bit issue. Another thing is that a lot of physicians are not aware of the telemedicine and the telehealth effort that's going on. So one another customer, they wanted to buy the watch she wanted to buy it for her mom. So, and she had peculiar conditions that she found out the WatchRx was just the right thing for her to do, because we allow a lot of customized reminders to be set. So she said, "Wow, this is really great." And I asked her that why can't this be covered by CMS? Because CMS had already said that we will cover chronic conditions. So they were using Medicare Advantage. I called Medicare Advantage. Nobody returned the call. Then I called their physician. The physician said, "No, no, no, we don't want to enroll such things. Those are all totally new. We don't want to do anything with that." So that we need to have a way of educating the physicians and the physicians group. Like these are new technologies that can absolutely no harm. You can still do your monthly visit if you have to, but it's absolutely no harm because you can track your patients. You can get to know how they are doing. And with a lot of automation, they don't even have to do much. They can just look at the report once a week and say, okay, they are fine. And we would automatically generate alerts if it's an emergency because we monitor the vitals. So we can tell, oh, this has gone into a critical condition. So you will have to immediately call the patient and talk to them. So that education has to happen. So that is missing right now. And I think there is something that I don't know whether there should be a group of us will have to start educating, or there has to be there's a great opportunity. There is a missing thing that is there, I would say.
Yeah, I mean, I'm curious to see, or I'm curious to actually hear from you. What do you think the pandemic has done to the life science industry in regards of the future? So what happens now? So all these doctors for months couldn't see their patients, not just in the States, but globally. We have a very large older community, but I mean, we have individuals that have underlying situations. A lot of individuals weren't able to get tested for COVID because they weren't showing any symptoms, but internally they could have, but externally they weren't showing it, so they weren't being tested. So what does your technology or any other technologies do for the future?
We could actually monitor the temperature. We could see that what kind of variation. We could measure their using motor symptoms. We can measure their whether they have tremors, whether they are stable, whether they are sleeping, or what kind of situation that they have, so that we can find out. Asymptomatic, of course, we cannot do anything. But even if there is a slight symptoms and if the people are not telling it, then we can find out. But more so, the people who do not have COVID, now there is a bigger issue, right? Because they are supposed to have their regular checkups, they are not going. So most of the physician practices, the smaller practices that we're running, that they're going out of business because nobody is coming and seeing them. So they don't have any revenue. So these are the things that we could do with the remote patient monitoring, because they will still get their revenue. So they can do via phone call, via video call through our platform. They can talk to the patient and they can say, okay, instead of, not every condition needs an in-person visit. Some of the regular ones like diabetes or blood pressure, hypertension, you could still monitor symptoms and you can talk to them. How do they feel? One of the things that we have is we worked with a company in Pennsylvania where they suggested that we could do a predetermined text messages. So we can basically, they can ask a few questions. We can prompt those questions to the patients and we can get it via watch. And they can determine how they are doing. Are they side effects? Are they losing their sleep? Or it is like they have diarrhea, whatever that situation is. So they can really guess. So all these things, you do not even have to go for an in-person visit. So those are the things that technology enables them to do in these situations, and especially the healthy ones, it's even better because they have to be monitored, and not going anywhere and not taking anything for 3 to 6 months is going to be a big thing. I mean, that is going to have a serious effect. And once the post-COVID, we are going to get another set of patients who are like, not treated, and so they come into hospitals for other illnesses. So we need to somehow take care of that situation.
Yeah, I feel that more and more, I mean, the pro and the con. It's convenient for the individual that doesn't want to go into the hospital or to their doctors. They're traveling around. They don't want to miss a doctor's appointment that took a full year to get. But it's also harder for the elderly want to be seen. It's like that's the only time that they go out. I remember my grandmother loved going to the doctors because she just liked to be seen by someone other than me. And so really is that human interaction of they grew up where doctors would go to their homes, and to have a world where now you're just communicating this way is just something that they're not used to, nor do they like. But it makes sense because the technology is growing and it's getting better and better. And so if I'm wearing a wearable, and mind you, I have my Fitbit on. So if I'm wearing a wearable and they can actually monitor me, and if there's something wrong that I'm not paying attention, where my heart's racing, but I think it's because I'm working out, but there's something else. If this can alert my doctor and I get a phone call, that will get me to be aware, because most people aren't aware of the underlying things.
Right.
There's a heart attack, where there's diabetes. People are just like assuming it's something else, or they're going to WebMD. To call out WebMD, but they're going online to actually see, oh, well, I have this symptom, maybe it's this, and it could have been something else.
That's correct. Yeah, that's exactly right. So, yeah, that's what this technologies help. I mean, technology is not a replacement for in-person visit, but at least it is definitely is going to help and reduce the number of in-person visits. Or even more, it is going to reduce the hospital visits. That is the most important thing.
Absolutely. Can you talk about when you decided to shift your career and you decided to do this and create this small business, this product, you're pitching, you're traveling around. I mean, what was that transition for you, and what did your family say, and what was the pros and cons? So I'm giving you a lot of questions. What did your family say? How was the transition, and what is the pros and cons of owning your own product, your own business, creating this new thing?
Yeah, actually, from the experience perspective, I had been in executive management and everything. So I had the confidence of running my own business. What does it take? What all need to be done? Whether it's financial or whether it is, even registering a company to how to manage people. All that was there. But it definitely needed a lot of support, because leaving a career and then you are doing full time, and of course no pay or anything like that, so you have to lose the financial chunk. But the thing is, the most important was my mom was excited when she said, wow, you are creating this. I think I still remember the way that they were watching the Boston Scientific and Google. I think that the whole thing, they kept on watching. I don't know how many times they did, and she was so proud. My parents were like, that they were top of the world that day. So same way, my sons and my husband, they all love it. So financially, my husband provides a lot of support. And my older son said he's the one who's going to come up with the company name. He did. My younger one's voice is recorded in the watch. I think everybody hears it. So everybody was very excited, and they are still excited. They support in whatever way that they could, whether it is editing a document, whether it is, everything that they help with. The lot of reviews my husband has done, I mean, it is tremendous. So, but the thing is, the one thing that I was not used to before, and I'm slowly learning, and I think I'm still learning, is how to pitch. I am not the person who go and talk outside. I'm fine with one-on-one calls, but like going and pitching, and it is like there was a lot of inhibitions. I have to start learning, and of course now I would have done almost 100 pitches, but the initial 10 to 20 pitches was like really hard for me. And that is the biggest thing I started to learn, and started to talk to people, because I'm not the extrovert. So I'm like, okay, if there is a need, I'll go and talk to person. So that's the type of person. So I had to open up quite a bit and talk to people. So that was a big change for me, from being as a engineering head in a company is different than having your own business, because you have to speak up, otherwise nothing will get done. So
All right. So one, I understand and I hear you when you say you're an introvert and not an extrovert, but you came to me and I'm clearly an extrovert and I scare you. So that was a good thing. But I keep seeing you are getting funding, you're getting attention, you're getting articles. I mean, you're being seen. So thank goodness the the introvert became an extrovert, because you had to, because you knew how important it was to the community. And so I think that you've done such a phenomenal job. And yes, it takes, the first 10 is always so painful, so painful.
oh yeah. So I still remember that I had to go talk. When I got that Boston Business Journal, I had to give a speech, and I kept writing and practicing and practicing. But when the actual award ceremony, I spoke completely. Whatever I wrote, I never spoke. I just completely spoke extrovert. And so surprising that I didn't even do that talk, and everybody said it was great, but everything came out like automatically. I never, the practice pitch never came there.
Because you were talking from your heart, and that's like the thing where even when you just said how proud your parents were and how your sons are involved and how your husband's involved, I think that's what makes it that much more enjoyable, where you know who you're doing it for and you know the importance of it, and yet you see the excitement of everyone that's in your life. That is like by far one of the biggest rewards ever. To see your product to someone, but to see your family supporting you is really, really, really big.
I still receive a lot of people, especially when I start talking. I make connections to investors. I make connections to potential customers. The one thing that I always hear is, "Oh, what such a great innovation!" Because this is something that I keep hearing. So it is not something that it has been like what 4 years plus, but still people love the product. They always like it.
Well, I said from the start, I love the product because my mother's in Florida. I go and it's like, I mean, I got her a Fitbit and she wears it all the time, which is great. This will be fantastic because she's further out, and it would just make me feel better as she's getting older. I watched my grandmother with the Lifeline, which the Lifeline is so archaic, and you are bringing that into a whole new level that people are really. I mean, everyone knows what a Lifeline is, but everyone has their frustrations with it as well. And so to know that there's an alternative to that, not saying that you go away from it, but to know that there's an additional alternative is a really great thing. If you, well, actually, how have you been doing during this pandemic? So you're home, you're working, you have a team. Like, how has this all been for you? And if you had to think about your first day when everything opens, what is your first day look like?
Actually, I have been working from home for the past 15 years, even in my because I used to have clients all over US and I used to have my engineering team in India. So I had to do everything is phone communication. Even when I had an office, I would never go to office because I had to continuously have calls. So but the only difference is it used to be only phone calls that time and now it's video calls. So that's the only change. But otherwise, it was always like that. I do have a space in CIC agency in Cambridge. So I used to go a little more often before COVID-19, but now, of course, I would reduce it. And I'm not going there at all now, but also post-COVID, I might have to stay away a little bit because we are high risk. So I don't want to unnecessarily go. I'll go for events and meetings, but not to go every day for work. So that's something that I will have to scale back. So in terms of COVID-19, that is not a big change. But COVID-19 had increased a lot of productivity because I had so many calls, and every week I would have 2 or 3 demos to potential customers. So that's something that has increased. So would continue to work that way. So it is not going to have that much of a change. But I will still limited ways will go out and possibly do this. One of the biggest drawbacks was COVID-19 was the conferences. They all got cancelled. And actually, I had Kim's conference I was to attend that got cancelled. So that was the big thing for me that missed out. And so I did a press release, but then that's not the same as going to the HIMSS conference. So that's the thing that I'm looking forward to when it opens up, actually.
It will be very different. So how have you thought about presenting yourselves when, I mean, we don't think we're going to see a conference. I mean, we definitely aren't going to see a conference until 2021. So how do you go about, I mean, how have you developed different ways of reaching out to those doctors in the hospitals when you know that we're not going to be able to meet at these conferences where a lot of these deals were solidified?
I'm doing press releases. I'm doing a lot of webinars and things like that. So it is of late has increased. And I also I was part of the accelerator. They streamed all our pictures and my videos and things like that. So actually there is an uptick of all those online things that's going on, the online presentations, video calls and everything. So that is what I'm doing. So press releases and webinars. It's not going to be equivalent to the conferences and in person, but that is going to continue. So I'm actually preparing for a couple of more webinars and press releases that we'll be doing in the near future. So that's the way it is. And LinkedIn navigation is the big thing. So that is what is happening right now. So I'm using a lot of LinkedIn tools.
Very beneficial in every way. So last question, if you had an ask for your personal ask or a professional ask for anyone that is watching you right now, what would be your personal ask and what would be your professional ask?
The professional ask would be that definitely we are doing a lot of pilots also. So anybody who's interested, whether it is a physician groups to try out the platform, the remote patient monitoring platform, or the consumers want to try our watches, or nursing homes or senior homes, they are most welcome. I would be open to conducting pilots with them. So that is my professional ask. Personal ask, I would still love to be connected with a lot of industries, whether cross industries, whether it is people from hospitals or from physician groups, as well as marketing and sales. That's my biggest next move. So the marketing and sales folks, as well as investors. So that would be my personally that I would like to connect and grow my network. So.
I am so proud of you. I'm so proud of you. I mean, again, it's just you have grown this company, this product so much. And I always say to people, just because I don't talk to you doesn't mean I don't watch you. The second you come into my world, I keep an eye of everything that you're doing. And to be able to see you've gotten so much attention to something that is, from the second I heard about it, it is so imperatively needed, especially when your parents are not near you. And more people are just trying to make sure that their parents are staying safe. And even just a lot of parents that were in the old folks home. I know it's not probably PC to say old folks home, but the residents, to know that you couldn't see the person. I mean, the Governor Baker of Massachusetts was saying that it was hard for him to govern the state knowing that he couldn't see his dad, but to be able to have that monitor to know those little things where I can't see you, I can't physically be with you, but just to know that I'm getting alerts of you're getting your medicine, you're like, you're feeling better, you have your high blood pressure, things like that. It's really good because sometimes parents, older parents, they lie to us and say, I'm fine. And that, which is like probably for me, it was really like, are you sure you're fine? And then when you're looking at them, like, you're not fine. There's something you don't look fine.
That's true, very much true. But the parents, because they don't want to say anything big, because they think that the kids will get, feel bad, so they don't want to say it.
Yeah, and it doesn't matter how old you are, you're still their kid, and
That's
they're still going to worry for you, despite the fact that we're now worrying for them.
Mm-hmm. Right.
Thank you so very much for taking time. I know you've been really busy. You had a busy day. I was a little bit late with problems with other people, so I appreciate you sticking around and having time to talk to me. And I'm so excited for you.
Thank you so much. It was great to see you, and hopefully we'll meet soon in Cambridge.
I know, and one day I will buy your product for my mom. I haven't bought it, but one day it will be that moment where she will decide that it's time for her to have one.
Okay. Yeah. Thank you. Thank you
All
so
right.
much.